Stigma is something that we've got to get rid of. Nobody likes to use the word dementia, but we're getting around this quite well with the help of the media. They are actually using the word dementia, and I think that quite quickly we're going to spread the word that dementia is something we can talk about, it's something we have to talk about, because it's only by raising this awareness that people are going to be conscious of their possible loss of memory, which then needs checking out and getting to their GP.
Currently around 820,000 across the UK who have a diagnosis of dementia. But the very sad thing is that there's only around 48% that actually have a diagnosis. So the figures are actually much, much bigger, twice as much. So in response to that at GMW, for the last couple of years, our memory services have been the target of our innovative practice and our development.
I think what hinders people coming forward for a diagnosis can be the stigma that's attached with having memory problems. I say that maybe perhaps people worry that society won't see them as the figure that they are, whether they're still working or whether they're kind of a family person, the roles that people have. They worry that if they admit their memory isn't as good, that they perhaps won't be able to do those things. For someone to go to the GP, what you'd expect to happen is that that GP obviously understands where that person is coming from, and perhaps maybe even either initiates that discussion or starts that discussion from things that perhaps the patient is describing, maybe more of a set of symptoms or episodes or incidents that have happened to them, and you'd hope that the GP would be able to pick up on that and perhaps then ask a few more questions about that person's memory, obviously hopefully being supportive and sympathetic to the person, but hopefully also giving them some confidence that there are services that can help support them.
When someone comes to the clinic, there are various emotional kind of ups and downs that they come through when they're actually talking to the doctor about the diagnosis. It can be very disconcerting, because in some cases the person who comes to the clinic may not be aware that they've got memory problems, and then suddenly they're told by the doctor that they've got a memory problem. It can make you feel angry. Sometimes it can make you feel very, very upset, because you might have thought of what you might have, and then being told by the doctor, it can make you upset. So in the memory clinic, we're very well aware of what can happen, and we believe that having a very sensitive approach and very honest approach to delivering a diagnosis helps immensely. I think people, once they have a diagnosis, need to know that they've got more choices available to them. It's not about a kind of a door with just a sign on it, it's about various signposts of support available to them. So I think it's important that people know that.
I think when anybody gets a diagnosis of any sort, there's always lots of questions, and that's quite natural. There'll be anxieties, there'll be worries. I think within the memory service, we offer post-diagnostic support service, and that is really aimed at looking around people understanding their diagnosis, being able to arm them with information and advice to help set them up for the future, to be able to cope really. Looking at carer support options, looking at legal and welfare and benefits advice as well. So we would offer one-to-one group work with people on a more individualised and tailored approach. The groups are quite small. They tend to focus around 5 or 6 sessions over a weekly period. Generally around living with dementia. What is dementia? What does it mean? Looking at different types of dementias. Looking at memory strategies, looking at aids, techniques on how to cope, answering questions like, can I carry on living as I've done before? What's changed? What do I need to look out for the future? How will I know when things are changing, and where do I need to go to seek some help? I think the whole philosophy throughout post-diagnostic support is very much carer focused as well. Understanding really, I think, the very valuable role that families and carers play with the person with dementia in keeping their independence.
From the carers that I've worked with, predominantly they talk to me about caring being all-encompassing. So they stay with that person 24 hours a day. A lot of their other aspects of their lives kind of don't function as well, and their predominant role is to be a carer for that person. So they tend to be supporting that person on their own for a long period of time. They also often with dementia, people may have some challenging behaviours. The carer is often the person that is the first person that would cope with those behaviours and see some of those challenges. And like I say, that environment in itself can be very stressful, distressing and upsetting for the carers as they watch dementia sadly have an effect on their loved one like it does. As a carer, it's healthy to refocus and sometimes take the break you need, take the time off you need. And I think to hear that from staff is very encouraging. That again helps with the feelings of guilt. If they're hearing other people say, you know, having one day off a week's fine. I think supporting carers not only helps the carer, but it can really have a positive effect on the person with dementia's care. So knowing that person's background, it's often the carer that can tell us a bit of history about that person. Often the behaviours that we might perceive as challenging might actually come from a specific need or a specific way that that person has been in the past, or a job that they had. They could have been a plumber and that's why they are trying to pull away at the pipes and things like that, and it's the carer that can really help us understand how that person was pre-morbidly and why they might be acting in the way they are now. I certainly think as well that if you have a happy family and happy carers, then they tend to be happier with the care, feel more able to speak up when they feel they need to, more able to ask for specific things, and that kind of open communication can only be positive for the person with dementia as well.
In relation to life story work, life story is something that we've got a lot of skilled and experienced staff who've been using life story for many years. But I think what we actually lacked was a consistent approach to life story work. So for the last 12 months, a group of key clinicians have been meeting on a regular basis on a month, and we've developed a life story forum. Part of that work, what we've been looking at doing, is to make sure that life story work is weaved throughout the whole dementia journey across GMW, that being within the memory service, within our community services and our inpatient services.
Life stories, essentially what we determine to be life story work is a process really of enabling people to record what's really important to them about their life history, about their experience, about their relationships. But what's important though is that life story work is not just all about the past, it's about who they are now and also their aspirations and wishes for the future. I think lots of people get mixed up between life story work and reminiscence, which reminiscence is very much around the past and recording that. This is much more about a very active process of engagement and relationship building really with the person. One of the things that we find about life story work, and in particular working with family carers, that it actually really helps the family carer to reconnect with the person as an individual person first and foremost, before ever they were diagnosed with dementia. It also enables them to feel much more confident about advocating what that person really wants and how that person wants to live their lives, and therefore builds their confidence and capability in terms of working in more of a partnership role with professional carers.
The benefit, both to me, I think, and to my husband, was going back and recalling old times, things that we'd forgotten, especially photographs that bring things back to you, times when we were both in Australia, and then when we came here, and it gave you a footing to talk about, something to talk about and discuss, and know that you were getting through to him. It was something we could do together, which is something that you can't do a lot of as their dementia worsens. So we could do that together, and we could discuss it, and we could decide what would go in and what wouldn't go in. And it was just a really good thing to do.
The environment that we provide care in is of utmost importance for people with dementia. Here at Woodlands we've been particularly fortunate in that we managed to secure some funding through the Prime Minister's Challenge monies in relation to building dementia-friendly environments. Part of that work has been to modernise our reception area through to modernising our garden, so it's a very sensory environment now in the garden. The real role of the dementia inpatient wards are around supporting people who have very complex behaviour associated with the dementia. But it's very important that there is somewhere where care can be delivered in a modern purpose-built way and a modern purpose-built environment, so that people can come into hospital, have an assessment, and we can hopefully improve their quality of life, ready for discharge, be that back home to the family members or onto a 24-hour care facility.
The Dementia Action Alliance is a collective of organisations who have all committed to improving their services and ultimately the lives of people with dementia. Dementia Action Alliances are seen as the vehicle of delivery for dementia-friendly communities, which is a term we're hearing a lot these days. But what it means is that a community is understanding, respecting and supportive of local people who are affected by dementia. It's quite a simple and straightforward expectation to have of a community, but unfortunately it is not a reality for every person who's diagnosed with a condition. Alzheimer's Society find that 1 in 10 people living with the condition leave the house just once a month, and the reasons they stated were they felt that their society didn't understand their condition, and if they did face problems going about their daily lives, they weren't confident that the society would support them to live well. So it's really important that not just health and social care are engaged with people with dementia and know more about the condition, but our entire community, so the post office, the taxi firms, the universities, so that people who are diagnosed with dementia have the best possible chance of staying at home for as long as possible. Greater Manchester West have been doing a lot of work to support dementia-friendly communities across Trafford, Bolton and Salford. They've had a huge presence in particular in helping Salford Dementia Action Alliance get off the ground. Yes, we want communities to be dementia-friendly, and we can say that it is about understanding and respecting people with dementia, but we need to hear directly from people with dementia to make sure that we're doing what's right for them. Greater Manchester West have provided lots of opportunities for local people diagnosed with dementia to share their views on what would make their community more dementia friendly.
Open Doors is somewhat a bit of a jewel in the crown really in the Salford service. It's a service that aims to instil hope in people once they get a diagnosis by having a positive role model in the Open Doors facilitator. That's Mike Howarth, who is a gentleman who has had a diagnosis of dementia for many years, and what his role is to instil hope and confidence and encourage people to live well with dementia. When the project was first developed, we were the first NHS trust in the UK to employ someone with dementia, and to our current knowledge, 4 years down the line, we are still the only NHS trust to employ someone with dementia.
Peer support was a main priority. We felt, in a sense, of bringing people together to talk to Mike, listen to people's concerns and comments and how we could improve our services. We initially started our Open Door support network, which were people that attended the post-diagnostic support group, then came and met with us, and we continue to do that to this day. It meets once a month. We also then set up the very first Dementia Cafe in Salford, which meets each fortnight. And we also provide a Singing for the Brain service on one of the wards at Woodlands, and most recently is our Open Doors Support Book Club.
I have to say, Salford is rather unique, and Open Doors in Salford, I'm sure, is something rather special. You don't get it elsewhere in the country, which is a great shame. I think if we could spread the word that we're doing, it could be a big help all round.
GMW is a huge mental health trust, and dementia care is only a very small element of that, but it's a very crucial element in relation to the organisation. The services we provide are for people right from diagnosis right through to end-of-life care at times. We do that within a community setting and within an inpatient setting. And from a future perspective, it's really important that we remain a specialist area and that the people who access our services get the highest quality care by the best and most competent staff that we've got.